Hello, everyone, and welcome to our module on conditioning and transference. Let's start by talking about the broad term of behavioral therapy. So the goal of behavioral therapy is to modify an unwanted behavior. For example, if you become anxious every time you try to go on an airplane, that's an unwanted behavior. You'd like to be comfortable and calm on the airplane. So one of the ways to deal with that anxiety is through behavioral therapy. And the goal of that therapy is for the therapist to help the patient modify their response to the environment. For example, their response to being on an airplane. And two key elements of behavioral therapy are conditioning and reinforcement. These lead to behaviors, so they can be the cause of an unwanted behavior or they can be learned by the patient in order to avoid an unwanted behavior. So the goal of behavioral therapy is to alter the conditioning and reinforcements in a patient's life so that they avoid the unwanted behavior. So let's start by talking about conditioning. Conditioning means the linking of a stimulus to a response. And the classic example, which you're probably familiar with, is Pavlov's dog. So what Pavlov did is shown in the bottom right side of the screen. He showed food to his dog and the dog would salivate because the dog was hungry and wanted to eat. He then rang a bell and the dog did not salivate. He then began to ring a bell every time he showed the dog food and the dog would salivate, obviously. And then over time, he was able to remove the food and just ring a bell and the dog would salivate. So this is called conditioning. What Pavlov did was he conditioned his dog to salivate whenever he rang the bell. And that's an example of classical conditioning. There's also another type of conditioning called operant conditioning. And we'll talk about both of these forms of conditioning in the next few slides. Classical conditioning involves an unconditioned stimulus and response and a conditioned stimulus and response. So let's talk about what those terms mean. An unconditional stimulus and response is a natural thing. In other words, it's natural for us to salivate whenever we see food. This isn't a learned behavior, it's just part of who we are naturally. And therefore, that's called the unconditioned stimulus because it does not require conditioning or learning for us to salivate when we are shown food. A conditioned stimulus and response is unnatural, so it is not normal for us to salivate whenever a bell is rung. That has to be learned or conditioned, and therefore salivating in response to a bell is a conditioned stimulus and response. And in classical conditioning, the responses are usually involuntary. For example, salivation is involuntary. You can't make yourself salivate. Or a patient may be fearful of something that they have been classically conditioned to fear. They're not choosing to be afraid of it, but they have been classically conditioned to fear that stimulus. Classical conditioning often comes up in behavioral therapy when you try to understand what are the stimuli that are causing a patient to react with fear or sadness or something along these lines. There are also some examples in clinical medicine. One of the classic ones is enuresis alarms for children. So children who bedwet, which is called enuresis, are sometimes treated with an alarm. This is a water-sensitive pad which is placed under the child's sheet, and the alarm will awaken the child if he or she wets the bed. And over time, what happens is the child awakens without the alarm. They waken from the sensation to urinate. So in this case, the unconditioned stimulus and response is the alarm causing you to awake. You don't need conditioning for that. An alarm will cause anyone to wake up from sleep. The conditioned stimulus and response is urinary fullness, which always precedes the alarm and conditions or teaches the child to awaken whenever they get that sensation. And the goal is to stop enuresis. So one way you can think about this is that classical conditioning involves an unconscious association that we have between a stimulus and response, and that's what drives much of our behavior, like fear or sadness or happiness. Operant conditioning, on the other hand, believes that much of our behavior is voluntary, and it believes that we behave in a manner based on the rewards or punishments that we receive. Certain things reinforce behaviors and we do those more. Certain things punish behaviors and we do those less. So this type of voluntary choice between rewards and punishments is called operant conditioning. And there are two main aspects to operant conditioning. One is reinforcement, which increases behavior. There are positive and negative reinforcers. We'll talk about that in a minute. The other element of operant conditioning is punishments. Punishments decrease behavior, and there are positive and negative punishments. So a reinforcement increases a behavior or response. And you've got to remember that anything that is a reinforcement must increase the frequency of behavior. If it decreases the frequency of behavior, it's not a reinforcement, then it's a punishment. We'll talk about that in a minute. So a positive reinforcement is very easy to understand. If a behavior is rewarded, then the person will do that behavior more often. For example, if you give a child a reward for good behavior, the goal here is to increase the amount of good behavior in the child. You're increasing the response through a positive reinforcement. A negative reinforcement is a little bit trickier to understand, and people often misuse this term of negative reinforcement when they're really talking about a punishment. So a negative reinforcement is when a behavior increases because of removal of an adversive stimulus. So it's the opposite of giving them a positive reinforcement where you give them a reward. In the case of a negative reinforcement, you take away something they don't want to increase the behavior. So a negative reinforcer is something you don't want that changes behavior and makes it more often. So one example is you wear sunscreen to avoid a sunburn. Here, your benefit of wearing sunscreen is nothing you can put your hands around. You're not getting a prize or reward. You're just avoiding something bad. That's a sunburn. So sunburn in this case is a negative reinforcer. Another example is if a child cleans their room to avoid the parent yelling at them. In this case, you're not doing anything to reward the child for cleaning their room, but you are avoiding a thing that the child doesn't want, and that is making them clean their room. So this is what's called a negative reinforcer. And once again, this is different from punishment. A lot of people misuse the term negative reinforcement when they mean punishment. A negative reinforcement increases from a stimulus. For example, sunburn increases the amount of wearing sunscreen that people do, or yelling at children increases the amount of time that they clean their room to avoid the yelling. A punishment's goal is to cause less behavior, and we'll talk about this on the next slide. So a punishment is something that decreases the frequency of a behavior or a response. Always remember, something that increases the frequency of a response is a reinforcer. Something that decreases the frequency of a behavior or response is a punishment. And just like with reinforcements, there are positive and negative punishments. A positive punishment is when a behavior leads to an aversive or negative stimulus, and this decreases the frequency of the behavior. And this is very easy to understand. For example, if a parent spanks a child, their goal with the spanking is to give a punishment so that the child stops misbehaving or stops their bad behavior. A negative punishment is when a behavior leads to a removal of a desired stimulus, not an aversive stimulus, a desired stimulus, and the goal is to decrease the frequency of the behavior. So, for example, my 8-year-old son loves to play with the iPad on the weekends. If he behaves badly, we take away the desired stimulus, the iPad, and hope to decrease the frequency of his bad behavior. The same thing happens at schools where children are told you can't go out to recess because you didn't behave well. That is the removal of a desired stimulus, which is recess, and that is an example of a negative punishment. So based on what we've been talking about in the last few slides, operant conditioning is sometimes thought of in quadrants. If you put behavior along the top and stimuli on the left side, you can then think of reinforcements and punishments based on whether they increase or decrease behavior and whether they involve the addition or removal of a stimulus. So remember what I said before, anything that increases a behavior or a response is a reinforcement. A positive reinforcement involves adding a stimulus, like adding a reward to increase the amount of behavior. A negative reinforcement means you are taking something away and you're removing a stimulus, and that increases the behavior. Punishment always decreases behavior, so a positive punishment involves adding a stimulus, like a spanking we talked about before, and a negative punishment involves removing a positive stimulus, like taking away the iPad or recess for a child. And the idea here is these are all ways to influence behavior. Sometimes therapists will use this when doing behavioral therapy to try and coach patients into behaving in a better manner and relieving anxiety and other problems. Let's talk about some other terminology related to learning and conditioning. Extinction is the gradual weakening of a conditioned response. So in classical conditioning, this means that the conditioned and unconditioned stimuli are no longer linked. For example, over time, the dog may start to respond less to the ringing of a bell. That's extinction of the conditioned response. In operant conditioning, this is what happens when behavior is no longer reinforced. If you stop providing rewards or punishments, then the conditioning may start to go away. And this is one of the problems with rewarding children or punishing children, is that you have to keep doing it or sometimes the behavior returns. Some other learning processes are shown on this slide. Habituation is what happens when repeated exposure leads to less of a response. So an example of this is if a child starts to get accustomed to going to the doctor and becomes less anxious. Many children are nervous the first time they go to the doctor, but over time they become less anxious and nervous. That's called habituation. Sensitization is the opposite. That's where repeated exposure leads to more response. So if the child goes to the doctor and is only mildly anxious, but then gets a shot every time they go to the doctor, they may eventually become sensitized such that they're highly anxious anytime you talk about going to the physician. That's called sensitization. Now let's talk about transference. And transference is something all of us do all the time. If you meet someone at work and they remind you of your boyfriend who you broke up with 6 months ago, you may react negatively to that person. You are transferring your feelings from your ex-boyfriend onto this new person. That's what transference is. And in therapy, it can affect the doctor-patient relationship because the patient may be reacting to the doctor not because of what the doctor is doing, but because of feelings that are being transferred onto the clinician. So the definition of transference is the unconscious projection by a patient onto others. These are often feelings associated with the patient's past, like a boyfriend or girlfriend who was mean to you in the past. And when this happens, the patient will respond to the clinician as if they are someone else. For example, many patients respond to their therapist the way they would to their parent because the therapist begins to remind them of their parent. And they might get angry with the therapist, but they're not really mad at the therapist. They're mad at their parent, and they're transferring that anger onto the therapist. This also comes up in marriages. Patients often respond to their spouse the way they would to their parent, and this can lead to marital discourse. It's not that the husband is mad at the wife or the wife is mad at the husband. It's that both of them have unresolved feelings about their parent that they are transferring onto one another. So when you're a therapist, you have to be aware of the phenomena of transference, and you have to try to understand it in order to help the patient. Countertransference is the opposite. That's when a clinician projects onto the patient. So for example, if the patient reminds a therapist of their son or daughter, they may start responding to them by transferring feelings about their son or daughter onto the patient. So once again, this is something therapists have to be aware of. They have to know who they are, and they have to know things from their past so they can avoid and or be mindful of ways they might be counter-transferring feelings onto a patient that they are trying to help. And that concludes our video on conditioning and transference.